Hey guys, welcome back to my channel. I make skincare videos here on YouTube. If you're new here, don't forget to subscribe, hit the bell so you don't miss out on any of my new videos. Today we're talking about psoriasis. Psoriasis is a chronic autoimmune condition. About 7.4 million Americans have psoriasis. It is a chronic autoimmune condition. So what does that mean? Our immune system attacks itself. So two factors when it comes to psoriasis: genetics and immune system. Doctors don't really know what causes psoriasis, but through extensive research, they are pretty certain that it's because of the immune system when it attacks itself. So we have white blood cells, the T cells will go in and attack the skin cells. And so, meaning, what do you see? If you have psoriasis, you will see red patches. And usually with red patches, you see like white silverish scale on your skin. And usually you see them around the joint areas. So elbows, knees, knuckles, the hands, things like that. But psoriasis can also develop on the face, the neck, the scalp, just really anywhere on the body, but usually around the joint area. And the scalp is also quite common. So with psoriasis, most people see it kind of like a reaction, skin reaction between the age of 15 through 35, like 28 being the average age for when people usually notice like pretty obvious case of psoriasis. And of course, you know, toddlers, kids can develop psoriasis, or even people older, but usually it's between 15 and 35. It's when people start seeing the symptoms. And with the red patches, white silverish scale that you see, sometimes they can be very sore and itchy, this burning sensation to it. So it just really depends on how severe the case is. Like there are really mild cases where you just see a small red patch, to moderate to very severe where psoriasis covers a large area of the body and it sometimes can bleed and the skin starts cracking. In terms of like getting rid of psoriasis for good, there isn't a cure for it at the moment. So in terms of treatment, you can look into a very common one is UV light therapy. So how does UV light treatment work? UVA and UVB, natural light, goes in and actually kills off some white blood cells so that it doesn't keep attacking your skin cells as quickly. And so therefore it relieves the psoriasis symptoms. Other things that might help are laser therapy, and also skincare products. Now going back, in order to understand what psoriasis really is, yes, it looks like red patches, it looks like silver scales, but what is your skin doing? Why is it doing that? It's because when your autoimmune system is on overdrive, it's attacking itself, it's actually speeding up the process of skin production. So our skin cells is constantly, in production, and it takes about 20 days, about a month for a full skin cell cycle. So it takes that long for our skin to go from our deepest layer to the surface and shut off. But when somebody has psoriasis, that 1 month cycle is sped up really, really quick. And instead of 1 month, it's actually a few days. And your skin is not able to shed that quickly. But because the skin cell is being produced so fast, that it's just building up on the skin. So it's like constantly producing skin cells after skin cells, and it's just like boom, 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 boom. With scalp, a really good and effective product to try is apple cider vinegar hair rinse or like shampoo conditioner. So there's this one that's known to be very effective. It's called Wow Apple Cider Vinegar Hair Conditioner Set. I'll link it down below for you guys so you can check it out if you're interested. And it's known to really help with getting the flakes off the scalp, helps with itchiness because that tends to be a very common symptom for people who have psoriasis. And of course, nobody wants flaky looking hair, like it'll start looking like dandruff and things like that. So a lot of people go in and try to find a hair product that contains apple cider vinegar, and that one seems to be really great. So there are skincare products that would help. For example, corticosteroids, like steroid hormones, like topical ones that you can apply, and retinoids, salicylic acid, vitamin D analogs. If you are going in with salicylic acid, you can use it about 2 to 3 times a week, but don't use it every single day. Retinoids, yes, you can use it every day, depending on your skin, depending on the percentage, and things like that. But in general, yeah, you can use it in your daily routine. So people with psoriasis go through phases. You might see symptoms like red patches, scales on the skin, whether it's cracked or bleeding, for a few days to a few weeks, and then it'll clear up. You'll see no symptoms. But that doesn't mean that your psoriasis is gone for good. It's just kind of dormant. It's just not showing its symptoms. It's not showing its head. And so you might go through weeks, months, maybe even like up to a year without seeing psoriasis. And then it might come back again. So it kind of comes and goes. And there are triggers to psoriasis. So for example, stress is a big one. A lot of people notice that if they are extra stressed, psoriasis does tend to come back. Or if they drink a lot, so high levels of alcohol might trigger psoriasis for some people. Sometimes skin injury does also cause psoriasis, like cuts, burns, scratches, abrasions, and things like that. When your skin is trying to heal, inflammation, infection. So when it comes to infection, your immune system kicks in as in like overdrive. And when it's in overdrive, it causes your white blood cells to again overproduce and attack your skin cells. Psoriasis is not contagious. If you touch someone's skin who has psoriasis, like active psoriasis symptoms, you will not get psoriasis from them. It is a very just like biological, genetic immune system condition, so you cannot pass it on to somebody. So there are foods that dermatologists suggest staying away from when you have psoriasis, one being dairy. I find that overall in the skincare world, dairy seems to be a big one, that a lot of people tend to be like, once I quit dairy, I find my skin has improved. It just really depends on the individual. Like I said in previous videos where I drink milk, I eat yogurt, and I don't see my skin being any worse than if I don't eat dairy, you know. Dairy, sugar, processed foods, red meat, so beef and things like that, they tend to cause inflammation. So because psoriasis causes inflammation and those foods are sometimes known to cause inflammation, if you avoid them, your symptoms can improve. So again, it really depends on the individual. It might work for some people, it might not. So you can try it out and see.